There are men and women everywhere at some point that have probably tried doing sit-ups in the hopes of having washboard abs, but for the majority of us that's never going to happen. Whether it's genetics, pregnancy, or even massive weight loss, sometimes you need a helping hand to achieve these goals. That's where a tummy tuck, otherwise known as an abdominoplasty, may help. So what is an abdominoplasty? An abdominoplasty is a surgical procedure that involves removing excess skin and fat from the abdominal area along with tightening the underlying muscles. The result is a flatter and more toned appearance of the stomach. Typically during pregnancy or even massive weight gain, the abdominal muscles will stretch apart to make room for the baby or all the excess fat below the muscle level. After a prolonged period of stretching, those muscles can be stuck apart, causing laxity to the lower abdomen. So no matter how much exercise you do, those muscles remain apart and causes the lower abdomen to protrude more than it did before. During an abdominoplasty, we use sutures to bring those muscles back together to tighten up the abdomen, giving you back a flatter tummy. And while that may sound great, a tummy tuck may not be for everyone. So who is a good candidate for an abdominoplasty? Good candidates for an abdominoplasty are those who are in good physical health, have excess skin or fat in the abdominal area, and have already tried diet and exercise to achieve their desired results. This procedure is also great for patients that have lost a massive amount of weight and are left with loose skin of the abdomen. It's usually recommended that you've been stable in your weight for about 6 months prior to having any surgery, as any further significant weight loss or rebound weight gain will alter the results of the procedure. So then who is not a good candidate for an abdominoplasty? Well, there are a few conditions that would not make you a great candidate for an abdominoplasty. The first one is pregnancy, as women who are planning on having children in the near future would be wise to hold off on this procedure, as the abdominal muscles and skin will stretch again, and all the work that we did to get you that great abdomen can be undone, possibly requiring another surgery to get the same results as before. Patients with significant medical conditions such as heart disease, uncontrolled diabetes, or a history of blood clots may not be good candidates for a tummy tuck, as these conditions can increase the risk of complications. If you do have medical conditions, they should definitely be discussed at length prior to any surgery with your surgeon. Patients who are considering this procedure for weight loss are also not great candidates. This procedure is more of a body sculpting procedure, and it may be more difficult to get as great of results as patients with lower BMIs. The amount of weight we remove from the lower abdomen is often just a couple of pounds for most people, so it's definitely not a weight loss procedure. The last thing that will absolutely make you a bad candidate for an abdominoplasty is being an active smoker. Smoking can increase the risk of complications during and after surgery by causing poor circulation throughout the body. So if your body can't properly deliver oxygen to the tissues that are healing, we can run into issues such as wound breakdown or even worse, tissue necrosis. It is possible to do this procedure on smokers, and typically, depending on your surgeon, you may need to stop smoking for about 4 to 6 weeks prior to surgery and refrain from smoking for another 6 weeks post-op in order to give your wounds the best chances to heal. How is an abdominoplasty done? This surgery is done in the operating room under general anesthesia, and once you're asleep, an incision is made across the lower abdomen, and then the excess skin and fat is removed, typically up to the level of the belly button. We then continue on up the center of the abdomen to the level of the rib cage, which then allows me to identify both edges of your abdominal muscles, and then from there, the muscles are sutured back together. This leads to tightening up the abdominal wall and giving some definition back to your shape. Next, the belly button that has remained attached during this whole time is marked in a new location, as the remaining skin is draped back down over the lower abdomen and pulled snug to give you a new abdomen. The belly button is then brought out through the skin and sutured into place. I really spend a good amount of time on this portion of the procedure, as it's the telltale sign that someone has had an abdominoplasty. The last part is the closing of the wound across the lower abdomen, sometimes with or without drains. Once your surgery is done, we'll place you in a compression garment and let you start your recovery process. Which brings us to our next part. What is the recovery for an abdominoplasty like? Recovery after your surgery will get better day by day. I typically ask my patients to walk hunched over for about 7 to 10 days to help keep tension off the incision as it heals, and then after about 10 days they can start walking upright. You may think that you can lie around in bed all day post-op, but that is the last thing I want my patients doing. It's actually better if you're up and walking around for about 10 to 15 minutes every 1 to 2 hours during the day, as this can help decrease your risk of developing blood clots post-operatively. I also send my patients home with a blood thinner that helps decrease the risk of developing blood clots in the legs as well. I expect you to have some discomfort for the first few days, but it should be well managed with the pain medications we prescribe for you. If you have drains, you'll need to record the output daily and bring that record to your post-op visits until the drain is removed, which is typically in about 7 to 10 days. Your swelling will begin to subside with the help of your compression garment over the next several weeks, and your full results won't be fully evident until about 6 months after surgery. So if you're ready to see a new you in the mirror and you want to learn more, I suggest checking out this video right here, where we talk all about how liposuction can help take your tummy tuck to another level. I'm Dr. Paul Pearce. Hope you guys enjoyed this video, and we'll see you on the next one.